For my presentation, I will be going over lupus. Four different types of lupus: neonatal, drug-induced, discoid lupus erythematous, and systemic lupus erythematous. The most common is systemic. It is a chronic multi-system autoimmune disease characterized by inflammation of the connective tissue and is marked by remissions and exacerbations. The body creates antibodies against its own tissues. This can lead to the formation of immune complexes, and it triggers an autoimmune effect that takes a toll on the patient's healthy connective tissues. It also has recurrent spontaneous exacerbations and remissions. Etiology is unknown. Potential causes could include genetic, hormonal, environmental, or immune responses. There's a possible genetic link because it is often seen in families, and there's a higher incidence noted in African Americans, Hispanics, Asians, and Native Americans. Some clinical manifestations seen in lupus. It can vary from mild to severe. A classic sign is a malar butterfly rash over the cheeks and the bridge of nose. It can be red, fixed, flat, or raised. The classic sign isn't always seen, but skin lesions may also be present. The first signs are fatigue and a fever that is recurrent. This is a multi-system disease, as I stated earlier, so it can affect many organs, including organs in the CNS, the renal, the GI, and the cardiac systems. It can also have a large variety of symptoms and complications due to how many organs it affects. Some later complications are just arthritis, anemia, thrombocytopenia. It can cause myocardial infarction, renal failure, memory impairment, seizures, ascites, pancreatitis, anorexia. Some procedures and diagnostic tests. The presence of 4 or more clinical manifestations would lead to further testing to rule out systemic lupus erythematous. There could be a CBC done. It would show elevated serum and arginine levels that may help support diagnosis. ANA antibodies would be positive in here, and that's one of the main signs of lupus. And below are just some more diagnostics that can be done. Patient and parent education. You would need to teach about the disease and what to expect. Teach some triggers and how to avoid them. Also, very important to have adequate rest. Teach over the drugs and other therapies that would be done for lupus. Signs and symptoms of further complications, such as signs of bleeding and myocardial infarction. Facial puffiness and foamy or coke-colored urine can be a sign of renal failure. You would need to know when to notify the healthcare provider. Try to prevent from smoking, drinking, avoid harmful activities and sports, and then teach about certain side effects of drugs that will be used during the treatment. The majority of the drugs used to help manage lupus would be targeted towards decreasing inflammation and preventing life-threatening organ damage. There's also a few drugs that can be used to target underlying problems of overstimulated B lymphocytes. Some non-drug ways to help manage lupus would be avoiding possible triggers like smoking, allergies, stress, infections, sunlight, and certain drugs. Also have adequate rest, and when you're having an exacerbation, let the healthcare provider know so they can help decrease the severity of it. Some interventions that you would use would be avoiding sunlight and other possible triggers, rest, at least have 8 hours of sleep, and also take naps if needed to help prevent fatigue. Well-balanced diet, maintain fitness. This will help with joint pain, and that is also common with this disease. Warm baths, cold compresses, and splints can also help with some of that joint pain. Provide support, and also local support groups can help. The progression of the disease is chronic in nature, so it'll last throughout their life and will also lead to their death. This has a 5-year survival rate with children diagnosed. It doesn't just affect the skin, but also underlying organs. And with each exacerbation and remission, the child's health deteriorates a little bit. So knowing the triggers is very important. Outcomes and expectations. Chronic will have for life, will ultimately end in the death of the child or adult. The leading cause of death is heart or kidney failure or CNS, like seizures. Advancements in treatments and therapies have helped decrease the mortality rates, and management and prevention of exacerbations is key. Some nursing diagnoses that can be seen is ineffective health management relating to the grieving process, ineffective coping skills related to grieving process and age of patient. So if they're an adolescent, they might not, they might take risky sports and such. Acute pain related to diseases, fatigue related to disease, and disturbed body image. Here are some NCLEX questions that might help you understand this disease better.